In-home telerehabilitation research with older adults in technology by Jillian Sanchez Herman. Points of overview. Telerehabilitation is now an option for older patients recovering at home from major surgery. Medical insurance companies are sending their medical personnel equipped with electronic devices such as tablet computers and wearable sensing technology devices to help give treatment to older patients at home. Medical personnel also need to be aware of the older patient's physical, cognitive behaviors in order to assure the patient receives an all-around level of care. Traditional doctor visits versus telerehabilitation, effectiveness and its downfall. An older adult's preference and willingness to get out of their comfort zone and having medical personnel in their homes, rather than doing treatments in their doctor's office. Research questions. What is the standard of care and who dictates it for older patients recovering from major surgery at home using telerehabilitation? What are some of the barriers that are being faced by older patients who are receiving telerehabilitation in their homes? Main arguments. Hospital rehabilitation versus telerehabilitation. Whether it's dementia or hip replacement surgery, older patients will want to stay the least amount of time in a hospital, and the government insurance company will agree with the patient in most cases should go home to recover. Of course, for some patients, that is not an option. Patient comfortability is of most importance when speaking of telerehabilitation at home after older patients have had major surgery or are dealing with a disease. Not only is the environment of the patient's home to consider, but the mental and physical capabilities, as studies have shown. Ailments and diseases. Patients with dementia and having memory issues have been found to benefit from playing PlayStation 2 Minecraft. Stroke patients can use a system called Rehab Reader, in which the patient squeezes a lever sensor to be able to make moves across a board. Main arguments. Technology training. While doing research for my paper, I discovered that there is an extensive list of technology available for a range of ailments or diseases. In the past, a computer tablet with Zoom application in order for the therapist to communicate for therapy sessions with the patient. Now we have sensors that monitor vital signs of the patient, and it reports it finds to the therapist and doctors in charge of care. Gaming systems have been found to be a better fit than some medical programs in rehabilitation of arms or finger movements or even memory for dementia patients. Issues, setbacks. Some things to keep in mind is that while there has been advancements in telerehabilitation when it comes to older adults and the use of technology for their rehab, there is still medical costs of equipment and trained therapists who charge by the hour, which could be covered by insurance for most, but not all patients. Implications for research and practice. Some things to keep in mind is that while there has been advancements in telerehabilitation when it comes to older adults and the use of technology for their rehab, there are still medical costs of equipment and trained therapists who charge by the hour, which could be covered by insurance for most, but not all patients. Simplicity should also be included when decided to use a game or an app for an older adult. While some enjoy the games, not all are interested in their virtual reality, for example, and problems with perception, which can disorientate an older patient. Personally gained. Doctors and therapists should not only take in consideration older patients' cognitive physical conditions, but also their personal interests when deciding what kind of type of telerehabilitation therapy they will be assigning. Perhaps not only involve the patient in the decision, but the caregivers of the patient, and truly explain and ask how far they're willing to be involved in the recovery of their loved one. In this course, we've learned to be mindful of older adults and to look at things through their eyes and not be so quick to judge them.